Airway obstruction in infants is usually caused by inhaling a small object babies have placed in their mouth, such as food, a toy, or another small object, for example, a button, coin, or balloon. Do not do back blows or chest thrusts if you suspect the infant has stopped breathing for other reasons, such as asthma, infection, angioedema, or head trauma. Do CPR in these cases. When an infant is choking, rescuers should determine if there is severe airway obstruction, which may endanger the infant's life. Signs of severe airway obstruction include inability to cry audibly, cough effectively, or breathe, with, for example, stridor, retractions, or cyanosis. There may be loss of consciousness. Do not intervene if the infant can cry and make significant sounds, cough effectively, or breathe adequately, because that means they do not have severe airway obstruction. Furthermore, strong coughs and cries can help push the object out of the airway. Tell someone to call for emergency assistance, 911 in the United States, while you begin first aid. If you're alone, shout for help and begin first aid. No equipment is needed. Hold the infant's chest in your hand and open the jaw by pulling down the mandible with your fingers. Position the infant face down along your forearm, supported on your thigh or lap, with the head lower than the body. Give 5 quick, forceful blows to the back between the infant's shoulder blades, using the palm of your free hand. If the object doesn't come out after 5 back blows, turn the infant face upward, still lying along your forearm, supported on your thigh or lap. Hold the infant's head in your hand. Place 2 fingers on the middle of the lower half of the sternum, just below the nipples. Avoid the lower ribs or tip of the sternum. Give up to 5 quick thrusts, compressing the chest about 1/3 to 1/2 the depth of the chest, or about 1.5 to 4 centimeters, for each thrust. Continue to deliver 5 back blows, followed by 5 chest thrusts, until the object is dislodged or the infant becomes unconscious. Do not try to grasp and pull out the object if the infant is conscious. If the infant becomes unresponsive, that is unconscious, shout for help, give infant CPR, call 911 after 1 minute of CPR. If you can see the object blocking the airway, try to remove it with a finger. Try to remove an object only if you can see it. Get the infant to an emergency department as soon as possible, even after successful removal of the airway obstruction and resumption of normal breathing.